I'm Dr. Frita. I'm a board-certified kidney doctor, and today I'm sharing with you how your face can reveal hidden kidney disease. I'm giving you 5 warning signs of kidney disease that can be written all over your face. When most people look in the mirror, they're just checking themselves out for tired eyes, new blemishes or bumps, open pores. But the truth of the matter is that your face is more than what you present to the world. It's actually a reflection of your internal health. The way your eyes look, the way the skin on your face feels, these can be hints that you have an underlying kidney disease. Over 35 million Americans have kidney disease, and most don't even know it. Part of the reason is that they don't know what warning signs to look out for. Looking at the face for health clues is not a new idea. In fact, as physicians, we are trained to do so. And guess what? Today, I'm sharing that knowledge with you because I'm giving you 5 warning signs of kidney disease that can be written all over your face. Keep watching. Listen, I love talking to you and us having these conversations through my videos, but you know what else I love? Talking to you one-on-one. So if you would like to have a consultation with me one-on-one, I do provide a telehealth concierge service, and I can talk to you from anywhere in the world. We have a conversation, a video call. I do a full history. I give you a first opinion. I give you a second opinion, and we can talk about kidney disease. But remember, yes, I'm a board certified nephrologist, but I've also been board certified in internal medicine, pediatrics, and obesity medicine. And so there's a whole lot of subjects that we can cover, and we can cover them one-on-one from anywhere in the world. It doesn't matter. So please, if you're interested, click the link in my description and let's have a telehealth concierge appointment. Please go ahead and click that like button and share this video because I'm about to give you some evidence-based medical information on how your face can reveal hidden kidney disease. It's true. Before you even brush your teeth or comb your hair, your mirror is telling you a story. But are you catching the most important parts? This makes me think about a patient I had. We'll call him Bob. Bob was a young, health-conscious patient in his mid-20s, and he was referred to me for possible kidney disease. When Bob got to the office, he let me know that he exercised 5 days a week, he ate mostly plant-based foods, and he kept his weight in a very tight, healthy range. He was the perfect picture of health, you might think. But the complaint was that he had swollen eyes, okay? He was swollen around his eyes. Now, Bob said that he first attributed this symptom to allergies, but then he noticed that his eyes would be swollen even when he had no other allergy symptoms. Then eventually his entire face started to swell and he put on weight. Ultimately, Bob did have a kidney disease. I was able to diagnose it and treat him. And the truth of the matter is that it was written all over his face. I'll tell you about Bob's diagnosis later on in this video. Meanwhile, let's go ahead and get started. Here are 5 warning signs of kidney disease that can show up on your face. Number 1, puffy eyes or periorbital edema. This is a tricky one because a lot of things can cause puffy eyes, right? Like what Mr. Bob had. My patient, when he had puffy eyes, he thought that he was just having allergies. And certainly seasonal allergies, hay fever, allergic rhinitis, these things can definitely give you puffy eyes. Also, if you get tired, if you just haven't had enough sleep, that can give you puffy eyes as well. And aging. We know that getting older can give us bags under our eyes that we really just don't want. Nevertheless, you must beware because puffy eyes can definitely be a warning sign of kidney disease that's written all over your face. Here's what happens. Your kidneys are responsible for filtering your blood. They get rid of excess water, they get rid of excess toxins, they balance electrolytes, get rid of excess electrolytes. Well, while your kidneys are filtering your blood, what they don't do is get rid of protein, not when they're working properly. When your kidneys are filtering properly, they provide a barrier that keeps the protein inside of your blood vessels where it belongs, and they don't allow the protein to leak out. Well, if you have kidney disease, then you may have an issue with your filtering system that's allowing protein to leak out, And this is a problem that could lead to periorbital edema or puffy eyes. Here's why. Your protein acts like a sponge, okay? When it's in your blood vessels, it acts like a sponge that helps to keep fluid inside of the vessels where it belongs. Well, if you have a certain type of kidney disease and you're leaking out this sponge, okay, you're leaking out this protein, then you no longer have that sponge that's keeping fluid inside of your vessels. So what happens? The fluid starts to seep out into your tissues. And when fluid seeps out into your tissues, it can lead to puffy tissue or swelling, edema, including puffy tissue in your eyes. And it can make your eyes look almost like you have soft pillows around them. Periorbital edema, puffiness around the eyes. There are many kidney diseases that can lead to a leakiness of protein, which can lead to puffy eyes or periorbital edema. One is an autoimmune kidney disease, like a lupus nephritis. You might lose some of the protein, causing you to have a fluid leak in the tissues around your eyes. You can also get a leak if you have diabetes. In fact, diabetes is one of the #1 causes of leaking protein out into the urine. And so again, early onset diabetic proteinuria, or when you're just starting to lose protein from diabetes, that can also lead to a puffiness around the eyes. Other disorders that can do it, infections. In fact, there's something called post-infectious glomerulonephritis. This occurs if you have a strep throat, for example. Certain throat infections will cause you to create antibodies to fight the bacteria that are attacking your throat, but a side effect is that those antibodies in some cases will also fight your kidneys, and they can cause you to have a poorly functioning kidney filter, which can lead to a leakage of protein and other things as well. And yes, this can lead to puffiness around the eyes. The point is that if you have puffy eyes, this could definitely be a warning sign for many things, including kidney disease. So make sure you consult with your physician. Number 2, changes in your facial skin color. Yes, looking at your skin, knowing your baseline color, and watching for a change can definitely give you a hint that you have kidney disease. So if your skin becomes pale, or if you get some type of a dull yellowish color, this could be a sign that you have anemia from kidney disease. And if you have darker skin and it's difficult to see if your skin is pale or lighter, then here's the trick. You pull down your eyelids. So inside of the eyelids is typically nice and bright pink, right? Go ahead, do it now. Go look in the mirror. Just put me on pause, come right back. If you look inside of your eyelids, kind of pull your eyelids out or flip your eyelids up, the insides should be filled with blood vessels, and it should be a nice pink, really a rich or even hot pink. Well, if you have a pale color, instead of it being nice and pink, if it's almost white inside of your eyes, that's another sign on your face that you could have anemia. Okay, so anemia, when I talk about anemia, I'm talking about low blood, right? You're a low hemoglobin, low hematocrit. What is the connection between anemia and the kidneys? Well, I'll tell you, of course. Your kidneys are responsible for producing a hormone called erythropoietin, or EPO. What this hormone does is that it stimulates your bone marrow to make more red blood cells. And of course, your red blood cells are the parts of your blood that carry the oxygen to your vessels, give you your energy, your nourishment for your tissues, and having adequate red blood cells helps you to not be anemic, okay? So your kidneys are very important for preventing anemia. If you have kidney disease and you're no longer making the proper amount of erythropoietin, then you won't make the proper amount of red blood cells. This can lead to low blood or anemia, and it can show up in your face as having pale skin, a pale face, or kind of a dull yellow-brown face, or pulling down those eyelids. Instead of them being nice and pink and filled with red blood cells, you'll have pale lids inside of your eyelids, okay? So yes, a change in the color of the skin on your face can be a warning sign of kidney disease. You also want to pay attention to other symptoms that might go along with signs such as a pale face or pale eyelids. If you're feeling tired, right? Because we know that when you're anemic, oftentimes you have low energy, you're fatigued, doing simple everyday activities might really just tire you out. So if you're getting a pale face, pale eyelids, and certainly if you're having very low energy or fatigue on top of that, this could be a warning sign that's written all over your face that you have kidney disease. Be sure to watch my YouTube video on CKD stages after you finish watching this video. Number 3, generalized facial puffiness or facial edema, also called a moon face. Yes, this is another warning sign of kidney disease. And you will recall our patient, Bob, ended up having a generalized puffy face. He had edema of the face. If this happens, then this can definitely let you know that you might have kidney disease. Other things can cause facial edema as well, including severe allergic reactions, angioedema if you take a medicine like lisinopril or one of the ACE inhibitors and it causes your whole face to swell. So there are other causes of facial edema, but very importantly, you must consult with your doctor if you have puffiness of your face because it could mean kidney disease. Here's what happens. There's different mechanisms, and then I'll tell you what Bob actually had. One thing, if you get puffiness in your face or excess fluid all over the tissues of your face, that could mean that your kidneys are no longer maintaining the proper salt and water balance, okay? So especially if you have advanced kidney disease, if you have CKD stage 4, certainly CKD stage 5, then it could mean that you're no longer filtering out the excess water, the excess salt. You might be holding on to that salt and water, and so it's in your tissues. And so it can present as a generalized puffy face, a puffy stomach, a puffy back, puffy legs, feet, ankles. You can have generalized edema or anasarca, okay? So that's from holding on to too much water from the kidneys not working well. Another thing that can cause a generalized puffy face as it relates to kidneys is something called nephrotic syndrome. Nephrotic syndrome occurs when you're not just leaking out a little bit of protein in your kidneys, but when you're leaking out a lot of protein, like more than 3 grams a day. And just to put that in perspective, it is normal to leak out 0 protein or very, very little protein each day. If you've ever heard of those 24-hour urine collection tests, where your doctor has you to collect all of your urine for 24 hours in a big red jug and you keep it in the refrigerator. Ooh, that's a whole nother story. Where basically we want to make sure in those collections that your kidneys are leaking out a minimal amount of protein, certainly less than 300 milligrams in 24 hours. Well, for people with nephrotic syndrome, they are typically leaking out over 3,000 milligrams of protein in their urine in 24 hours, sometimes 5,000 milligrams, sometimes 15,000 milligrams, okay? And when you're leaking out this much protein, remember how I said that your protein in your bloodstream is like the sponge to keep the fluids inside? Well, if you're leaking out over 3 grams of protein in 24 hours, you can imagine that you really have no sponge left inside of your blood vessels. And so a whole lot of fluid can seep out into your tissues. And that's what can really lead to the puffy face, nephrotic syndrome. Be sure to check out my video on nephrotic versus nephritic syndrome right here on YouTube after you finish watching this video. There are many diseases that can cause a huge leakage of protein into the urine. The number 1 cause of proteinuria, diabetes. And yes, it's possible for diabetes or diabetic nephropathy to cause one to lose over 3,000 milligrams of protein in a day, which very definitely can lead to a super puffy face. Some other forms of kidney disease that can cause nephrotic syndrome include lupus nephritis, or kidney disease caused by lupus. There are different forms of lupus nephritis. One is called a membranous type, and that can cause you to lose over 3,000 milligrams of protein in your urine a day. Also, a condition called FSG, or focal segmental glomerulosclerosis. This is actually the most common form of glomerulonephritis among people of African descent. And then there's something called minimal change disease. Yes, minimal change disease. In this kidney disorder, the filter of the kidneys is definitely affected, and you have something called a podocyte effacement. basically the structure of the kidneys, the parts of the kidneys that are supposed to help to keep a barrier and to keep protein from leaking into the urine, well, that's pretty much destroyed. And you also get a problem with the charge of the kidneys. Okay, so the kidney filters typically have a negative charge. And we know that proteins also have a negative charge. And so if you take it back to science class 101, hey, let's go back, then you know that negative repels negative, right? So if you have a negative charge in the protein that's going through the bloodstream and a negative charge in the kidney filter, then that filter will repel the protein and keep it in the blood vessels, keep it in the bloodstream where it belongs. Well, in minimal change disease, with the destruction of the kidney filter and these different parts of the kidney filter, you no longer have that proper negatively charged barrier. So what happens? Honey, the protein just starts leaking and leaking into your urine. And then, of course, you lose the oncotic pressure. You lose that nice pressure of the protein acting like a sponge to keep fluid inside of your vessels. And so you get the puffy face, puffy body, puffy arms, puffy legs. So when you think about my patient Bob, who initially had puffy eyes and went on to have a very puffy face, he actually had a diagnosis of minimal change disease. How do I know? I did the test, tested his urine. He had well over 4,000 milligrams of protein in his urine in 24 hours. Not only did he have a generalized puffiness of his face, he also had puffiness in his entire body. He had anasarca, or generalized edema. We did a kidney biopsy where we took a sample of his kidney, and indeed, under the microscope, he had classic minimal change disease. Okay, that was his diagnosis. And you also recall that I shared that Bob was someone who normally kept a really tight look on his weight. Okay, he kept his weight within a tight range, a tight, healthy range, but then he put on a lot of weight. Well, the reason he put on so much weight was because he was holding on to excess fluid, right? He was holding on to fluid. And so he had gained something like 40 pounds of water weight. Minimal change disease. He had puffiness, and so his kidney disease was written all over his face. If ever you notice that you have a puffy face, especially if it's mixed with puffy eyes, swelling all over your body, if you notice a bubbly urine or a really foamy urine, like if you think about pouring a beer, or like the way it looks on beer commercials where there's that white foam on top. If you have foamy urine that looks like that, then that could mean that you have a lot of protein in your urine. So if you're getting any of these signs or symptoms, make sure you consult with your doctor right away to make sure that you don't have this type of kidney disease. Number 4, a rash on your face or an itching face. Yes, kidney disease can lead to you having itchy skin on your face, and this could be a warning that you have kidney disease. Your kidneys are responsible for filtering out a lot of things. You know, they filter your blood out, they get rid of excess toxins. They also help to balance your electrolytes, and they help to get rid of something called phosphorus, okay? We all encounter phosphorus in our foods. We have phosphorus in nuts. There's phosphorus in milk. There's also a lot of phosphorus in ultra processed foods, okay? It acts like a really great preservative, not so healthy for you. Well, if your kidneys are not filtering properly, then instead of you getting rid of the phosphorus in your urine, you will have a buildup of phosphorus in your bloodstream. And one of the effects of having a high amount of phosphorus in the blood, or hyperphosphatemia, is that it can lead to itching. And I don't mean just a little bit of tiny annoyance, pat itching. I mean an intense itching that will make you scratch. And it can even cause you to leave like scratch marks in your face, or break the skin and have excoriations or scratches in that regard. And yes, this can happen on your face. It can happen all over your body. It can certainly happen on your face, and you can get little dark patches or a rash that are associated with high levels of phosphorus. And so if you're getting a rash on your face, itching skin on your face, then please pay attention. Oh, and there are things that we can do to treat the high levels of phosphorus in the blood. Number 1, we ask that you limit the amount of phosphorus in your diet. In most cases, the limitation should be less than 800 milligrams per day if you have advanced kidney disease. Consult with your doctor, consult with your renal dietitian. Also, there are certain medicines, certain phosphate-lowering therapies that we can have you to take that can also lower the phosphorus in the blood. Number 5, an unusual dryness on the skin of your face, or even a frosted appearance on your face, uremic frost. let's talk about this uremic frost, because this is very rare, at least in the United States. But if ever you have a uremic frost on your face, this is an emergency, okay? This is not something you sit there and contemplate. Urea is one of the toxins that your kidneys filter out. When you have very advanced kidney disease, you can get a buildup of urea in your blood. And if that urea, that BUN, blood urea nitrogen, if that urea builds up to excessively high levels, then it can start coming out of your skin through your sweat glands, and it can crystallize on your face, giving a powder-like appearance. This is a uremic frost. This is an emergency. You need to go to the emergency room or call your local emergency telephone number if ever you see uremic frost. Again, this is something that's very rare in the States, but it can happen. You want to be aware. Also, just an unusual dryness of the face. We know that the kidneys filter out excessive toxins, and certain excessive toxins or even electrolytes can cause your skin to be just brittle and just very, very dry. So if you have an unusual dryness on your face, or Lord forbid, uremic frost, then hey, these are other facial signs that you might have a hidden kidney disease. You know your body, you know your face. And so when things are changing, I don't want you to just sit home and contemplate and say, oh, maybe I'm just tired. Maybe I'm just getting older. Maybe. Yes, maybe a lot of things. But you want to make sure that you're not missing something as important as having kidney disease. Oh, there are many more warning signs and symptoms that can appear on your face and other parts of your body. The key thing that I want you to remember is that paying attention to every part of your body and everything that leaves your body, everything that goes out of your body, it's very important in order for you to pick up on warnings of serious diseases like kidney disease. If you found this video to be helpful and informative, please be sure to click the like button and to share this video with the people you care about. I want you to do your best to live your healthiest, happiest lives, and I appreciate you, as always, for your support. I'll see you next time. I'm Dr. Frita.